I'm going to explain just how broken the medical model is when it comes to things like constipation, heartburn, things of this nature, and how chasing after these types of symptoms with medications as innocent as baby aspirin is problematic, and exactly why that is. We're going to talk first about what the American Heart Association and the American College of Cardiology has released in their document about aspirin and why they are no longer finding it to be as effective to prevent things like atherosclerotic cardiovascular disease. So this is important stuff because I've said many times that just aspirins alone kill 16,000 people a year in America because of the hemorrhaging that is created with this type of product, okay? Again, aspirins people think are so innocent, but like all the other prescription medications, it remains true that they are not foods, okay? It starts off as a food, which we're going to talk about, so let's get into it. This was released by the American College of Cardiology and the American Heart Association, and what we need to talk about first is that aspirin is synthetic, okay? And it's known as what, by the time that the lab finishes what they've started with, okay, they have salicylic acid. By the time the lab does their thing to it, now it's changed its form into acetyl salicylic acid, okay? This is what aspirin is, acetyl salicylic acid. This is what the natural form once was, and then they take aspirin and they change it into this, okay? Now, this is directly from that report. And you can find this online by just searching the American College of Cardiology or the AHA for the American Heart Association. And this is where you're going to get a lot of this info. So it says, quote, aspirin should be used infrequently, okay? Infrequently in routine primary prevention of atherosclerotic cardiovascular disease. Also, 50 adverse effects have been linked to aspirin, like gastric ulcers. The acetyl salicylic acid, which is aspirin, is synthetic and it's not a food. None of the medications are foods. Acetyl salicylic acid, here's the big kicker, guys, it results in acetylation of hemoglobin, which essentially alters structure and function of your red blood cells. RBCs mean red blood cells, and your blood tissue. How is that a good thing? Right? Why are people hemorrhaging to death when they take aspirin, even baby aspirin? Because of this. That acetyl compound, acetyl salicylic acid, or aspirin, it results in acetylation of hemoglobin, essentially altering structure and function of the red blood cells. And then finally, acetyl salicylic acid does not exist in nature. It is produced through industrial synthesis. Okay? Let me talk to you now about why I'm talking about aspirin and why I'm going to link it up to this patient that I just saw and how it all makes sense. And many of you watching are doing the same exact thing. Many of you who may not be watching, but you know somebody who is on aspirin as well as omeprazole and things like this. So let me turn this around and show you the medications that this patient that came here is taking. He is 86 years old, male, and he has been taking these drugs for years. His primary symptom and complaint is low energy, constipation, gas and bloat, and he can't sleep well. Okay? This is typical, and I'm telling you, it's not that I'm special that I know I'll be able to help this person and the thousands like him. It's because I have an understanding of how the body works and how food is the real medicine and how the best doctor of all resides within. I'm not the best doctor of all. Dr. Jones, Sally, MD, they're not the best doctors of all. The best doctor of all resides within. And until we start working with doctors who embrace this truth, we're going to have a lot of sick people wandering the planet. All right? Here is what this patient is taking. I don't know if you could read this well, but this up here, this is a heart med because he's got high blood pressure. He's taken omeprazole. No surprise. Virtually every patient coming here does. He's taken a couple of different drugs for urinary flow and the prostate. He's taken pravastatin, a statin drug. He's taken, this is the other prostate drug. He's taken baby aspirin, and he's taking, I think this is a generic for Ambien for sleep. Okay? So he's taking a heart pressure med, an antacid, 2 meds for flow, urinary flow, and prostate function, a statin drug, and a baby aspirin. We're going to call this patient, we're going to call him Bob, just as a nickname. Okay? Let me explain to you what's really going on here and how the medical model is never going to pick this up. So I've got on my board a little test for you. Deficient blank blank causes blank bile. This is in my book, the Gut Check book. If you guys are not aware, I've written a bestseller book called Gut Check. Okay, you can pick that up by going to thegutcheckbook.com. I talk all about what I'm about to say to you right now in my book. But deficient stomach acid creates or causes thick bile. Why does that matter? Let me tell you why. First off, he's taking omeprazole every day for years, if not over 10 years. That is going to be a recipe for deficient stomach acid. As you would imagine, an antacid means less acid. Here's the problem with that. In your stomach, when there is food present, you want acid. It's imperative that you have acid. In the presence of food, you want acid. Why? Because only in the presence of acid are you going to effectively digest your proteins and absorb minerals. That has to happen in the presence of acid. That's a good thing. Remember, your proteins are your healing nutrient. Proteins are responsible for energy, growth and repair, and homeostasis. What kinds of things in homeostasis, Dr. Christine? Blood pressure, pulse, oxygen, concentration of fluids, and so on and so forth. Proteins are huge with that. Did I say something about blood pressure and pulse? I did. And is that going to be maybe why he's on this blood pressure med? Partly. You got that right. Okay. Now, so my little patient, we're giving him the name Bob. Okay. He's taking all those meds I just said, and here are his complaints. This is what he's complaining about, but he also has high blood pressure. Okay. He's not really mentioning that one because he doesn't really feel that that's affecting his lifestyle. You know what I mean? Because again, I talk about it in my book as well. You may have something going wrong like high blood pressure, but you don't necessarily feel the effects of having high blood pressure, so it doesn't really bother you so much. You see what I mean? That's why we shouldn't judge our health by how we feel, but rather how well we function. So same thing. You might have a calcium deficiency, but you don't necessarily feel that that's a symptom, right? You don't feel that that's impacting you. So let's get back to our teaching here. So he's taking now omeprazole, which is going to prevent this from happening to its proper standard. So when you take PPIs or antacids like omeprazole, like Prilosec, like Prevacid, like Protonix, and so on, now you are not allowing, okay, so not allowing proper stomach acid in the stomach. Would you guys all agree to that at least? Right? If you're taking an antacid, it's going to block acid. So then what happens? Well, now he's not going to properly digest proteins, which is going to affect his blood pressure. He's not going to effectively absorb minerals, which is going to affect his constipation, meaning it's going to create that because he's not going to get as much salt or sodium or magnesium, which aid in the whole health of a human person, not to mention bowel movements. When you are taking drugs like omeprazole and Protonix and so on, you are not getting to that stomach acid level as I've just established. But here's the thing that people miss, and that's this. With low stomach acid, or ineffective, or deficient, I should say, with deficient stomach acid, now you're going to create thick bile. Why is that, and what does that matter? Well, a few things. When there is not enough stomach acid going into the small intestine, your body accurately recognizes this. If there's less stomach acid than normal, your body recognizes this and then secretes less bile as a result. Less bile, here's the key, less bile means, in many cases, that person's going to have less fat digesting power. Less fat digesting power, because you need bile to degrease the fat that you've just consumed, because there's only a little bit of fat digestion happening in the stomach. Just a little bit in the stomach. a lot of protein digestion is occurring, provided that you're not taking an antacid or a proton pump inhibitor, that is, right? But now we've messed with the acidity of the stomach by taking a chemistry drug that's, among many you'll see here in these drug books. Now you have thick bile, which means you're going to be impaired at your process of degreasing those fats. And when I say degreasing, what I'm trying to explain is that fats are very strenuous on the body to digest. Fats are very difficult to digest. A massive process has to ensue for that to happen. So bile acts as a kind of like breaking the outer layer up of that fat molecule. Then other things will happen too to make that fat water soluble, okay? To make that fat more bioavailable inside the body. That's a huge process. But you need bile to do that. And when your bile is thick or less of it, then you're not going to degrease those fats as effectively. Now here's why that's important. For these reasons, this constipation that Bob has is coming from, number one, he's not digesting proteins and minerals properly because he's taking an acid, omeprazole. That's going to create constipation, just that. But further, his blood pressure is going to be affected by this because when you have thick bile, now you're going to be affecting the things that fats create in your body. So when you have thick bile, you're going to have deficient fat digestion, which means you're going to have deficient ability to create things like phospholipids, cell membranes, okay? Your prostaglandins, which are very instrumental in blood pressure and smooth muscle contraction. Now you're going to dampen that process because fat digestion hasn't happened properly. So it's all connected. So as I said to you, this patient came here for constipation and low energy. He's clearly not digesting food well. He didn't even know what an enzyme was, as many people don't. Instead, he's taking 1, 2, 3, 4, 5, 6. He's taking 7 prescription medications. Now, let me just say this. For 86, he seems like he's in amazing mental health, which is great. Because that's the thing, is the other thing that fats create are cholesterol, which your brain needs. And he's been on this statin drug, which dries up your cholesterol for a long time. So thankfully, he's on CoQ10 because cholesterol drugs will make that whole process of the heart and CoQ10. Your heart's like energizing nutrient is CoQ10. Thankfully, he's taking that. I think that might be making things a lot better for him. But he's very with the program. For 86, he's amazing. He's very sharp, very talkative, very chatty, very fun, right? But he's got low energy, he's constipated, he can't sleep, he's gassy, he's bloated, he has high blood pressure, and that's why. Because in part, these prescription medications are creating problems that he might not feel like the high blood pressure, but they are there. And that high blood pressure is there because there's a deficiency with his fat digestion. And that's because he's messing around with his stomach acid, which is making less bile, which makes that bile thicken. And then that is going to impair the process of digesting fat. Simply put, if I'm going to summarize, get this main point, and that is, the salient point is that you need bile to digest fats. Okay, you need bile to crack that shell, that fat shell, if you will, to make the body be able to use fat. He's taking a baby aspirin, and according to the American College of Cardiology and the American Heart Association, they are saying to you that their product should be used infrequently, okay? I mean, imagine if I told you that Smart Carb should be used infrequently. Can you imagine, right? So why are these people dying? Like, why are so many people dying that are taking aspirin? They're hemorrhaging to death, right? They are messing with their body's biochemistry. They're tampering with the body's natural order, and that's why high use of baby aspirin or aspirin at all can lead to things like Crohn's disease, Reye's syndrome. H. pylori is a direct result of aspirin use. Okay, there are so many adverse effects to what's going on with aspirin use, even baby aspirin use. So that's why Bob, my patient who came in today, this is why he is sick, all right, or having stress, or having these symptoms of constipation and low energy. It's because the digestion of food is not happening to the adequate degree that it could be. And never will that be established by going the medical route and having them throw medications which aren't foods. They start off at food like salicylic acid, but then people get in their white lab coats, they start messing around, they now make it acetyl salicylic acid, not the same, synthetic now, made in a laboratory, all right, industrially synthesized, and people wonder why their energy is tanking. Think about that. Think about how much energy your body has to utilize to remove a toxin, like acetyl salicylic acid. Do you think that would require energy? Of course it does. Do you think that eating cooked, heat-treated food sucks energy from the body? Of course it does. So, wrapping up, the very first step people could be thinking about is taking a digestive enzyme. You can have a bottle if you want. Just pay the free bottle. This is $12.99 retail. Free if you just pay the shipping. This is worldwide, by the way. How about we start looking at digesting food better? How about we start looking at how food is the real medicine, and foods are fats, carbs, proteins, vitamins, minerals, and enzymes? How about we start looking at that process versus throwing all of this chemistry inside the body, disrupting the body's natural order, creating more of an energy loss? How about we start there, right? How about we just start there? Probiotics are great, guys. Everybody sees probiotics commercials on the TV, like, I don't know, 10, 20 times a day if you watch TV. I'm sure you're seeing a probiotic commercial. How many commercials are you seeing about an enzyme? I'm hoping to be the first. So again, Smart Carb is an enzyme with black pepper, turmeric, and cinnamon. Enzymes are magical special proteins that digest your fats, your carbs, your proteins. So that's what I have for you today. If you know of anybody that's on aspirin, baby aspirin, omeprazole, has low energy, is having a hard time sleeping, it all can be traced back to the gut. Believe it. I see this kind of thing all the time on that board, what that patient Bob is taking, and there's a much better way. And again, I'm all for the medical model when it comes to crisis care, emergency care, trauma care. I get it. But when it comes to managing constipation, Crohn's, and so on and so forth, I do not get it at all. I don't like it at all. And that's why I'm here. I'm here to save 5 million lives from the broken medical model. This video is probably one of the best videos out there about telling you exactly how all this stuff happens. Talking about the importance of fat, talking about the importance of protein, talking about the importance of having proper adequate stomach acid, because deficient stomach acid leads to thick bile. Deficient stomach acid sets the tone. So everybody stop thinking that your probiotics is the savior, right? There's so much more things that need to be happening before probiotics. And that starts with enzymes. That starts with having adequate stomach acid, because it's way up there, right? I mean, digestion's happening above the intestines.